examination, probably what steps you have taken to clear this exam in the first attempt, because that will save there a lot of time. So I will request you to guide these students. Probably the students, they would be having so many questions for you, so you can answer their questions also. So with this, now I hand it over to Purva. Uh, Please guide our students, Purva. Thank you.
Thank you, sir. Hello, everyone. I'm Purva. Look, I'll just say this foremost, that what works for one does not necessarily work for everyone. So I'm just going to give you I'm just going to tell you my experience. I'm not going to give you any strict set of guidelines that you could use to ace the test. So I'll be sharing my mistakes and like the things that I realized during my preparation and similar other stuff, so that you can gain some insight on your own prep and hopefully avoid the mistakes that I made. And also, in the same process, maybe gain some suggestions which could prove vital to your own preparation. If you guys have any doubt, please feel free to ask. Or if you want to discuss something, please feel free to voice it.
Hi, Purva. Congratulations, first of all.
Thank you.
It's very good news. So I have few of the questions. The first thing is, there is one thing that every student make, that is study schedule or timetable, but it's really very difficult to follow it. Like there are things that get, there are topics that get keep on pending and things pile up. So my question was, regarding this, what do you think?
Hello, I'm not able to hear you, Tanish.
Sorry. My question was, there are approximately 11 systems for step 1. So what do you think approximate time that should be given per system, like a week for a system or less than a week or something like that?
Look, it is true that like the examination is long, right? You have to prepare for a long duration. So it's not possible to study for long hours every day, right? And because eventually that leads to burnout and fatigue. You won't be able to study for so many hours, months on end. So make sure that whenever you make your timetable, make sure there are days where you just keep catch ups, so that if you miss out something someday, then you can catch up on that day. Make sure you have break time. Make sure you have allotted space for activities that you like, so that it would help you regenerate. And so that will keep you fresh basically, and not make it like a boredom for studying. Okay. And secondly, what I would say is that, look, you know how much you have prepared, right? And as you said, like some topics you have done really well and some of them not so great, right? So I personally think it's not equitable to allot equal time to all the topics. Because see, what happens is the subject that you do know really well, if you say if you allot 1 hour to that subject, and when you only need like 15 minutes to revise it, you're basically not utilizing your time very resourcefully. And let's say if there's some topic that you have not done that well, but then you have also allotted 1 hour for it when you actually need 2 hours, then you're rushing it, and so again you're not doing it as you should have done it. So what I would suggest is that according to how you have prepared, a lot time likewise. Don't be like, okay, 1 hour per such system. Be like, okay, I have done this well, so I just need to do a quick review, but then I have not done this that well, so I would probably need some more time for that.
Thank you so much.
Okay. Anything else?
Hello, Purva. First of all, congratulations. And I had some questions. So first of all, I wanted to ask that when exactly did you start preparing for examination, like proper preparation?
Okay, so I took about a year, not completely a year, but almost a year. But I did my dedicated preparation for 3 months. So yeah, so usually from what I have heard, even from our seniors, is that it takes about 6 months to a year to crack the steps. So with like after your basic sciences. So there's a non-dedicated time and a dedicated time. A non-dedicated time is when you do when you review big literatures. Okay, so for example, you're reading from Golijan, or for example, you're watching sketchy videos, BNB videos, all those learning stuff. That is non-dedicated time. And then dedicated time is when you're just doing a quick review of systems. So when you're doing just the Q banks, for example, so that would be the dedicated time. The dedicated time, I will not recommend going to new resources during the dedicated time, because that is not going to fruitfully utilize your time. So basically what I would suggest is that when you do the preparation, when you do the studying, right, of new topics, do that in your non-dedicated time. When you're in the dedicated preparation, just focus on what you already know, reviewing that topic. Because see, when you assess yourself with self-assessments and stuff, if let's say if you're just passing, or like if you're just short of passing, and you decide, okay, I am not doing so well in this area, so I'll focus on that. What you do is you kind of in the hindsight, you kind of ignore the topics that you do know well, but that is not working in your favor, because you have to remember that the vast chunk is what you already know, right? Because for example, you get 190 and you need 202, so you already know the stuff that gave you 190. It is not wise to ignore that and go behind what you don't know. So I would suggest keep on revising what you do know, and side by side, maybe a bit or bit by bit, you learn the things that you don't know as well. I hope that helps.
Yeah, and like what resources did you refer?
Okay, so I personally used Sketchies. I used Pathoma. I used QBanks. I used Kaplan, Amboss, UWorld, First Aid, obviously, and I saw a bit of YouTube. Like there are some YouTube videos, right? So yeah, which helped me answer some few questions. Like they just tell you the question tactics. So I watched a few of those videos. However, yeah, this is one thing that I would recommend to avoid, is not to branch out to too many resources. I know that is like everyone says that, and even I was told that, but still I did it. So like I'll just say that again, that don't branch out to a lot of resources, because see, there is the same thing being taught but in different ways, right? And the thing is, just stick to the resources that are well known for it, and you would be able to cover it effectively, like not spend too much energy into it and yet being able to get the results. So I would definitely recommend that.
Okay. And one more thing, that I heard that we have to give NBME exams during rotations too. What exactly is that? What's the pattern?
Those are basically just subject examinations, and the pattern is like NBME actually. So it's basically like after you complete each rotation, you have to give an exam based on that rotation before you move on to the next rotation. And so you would also have to give it on the center, but like the hospital is the center. So you just go to the hospital for a day, give the exam, and you can continue with your next rotation. I don't really know the pattern of it as of yet, because I have not given one myself. But from what I have read about it, it is supposed to be, I think, 110 questions exam. And yeah, it's not supposed to be that tough. I don't know, but then it only consists like 30% of your total evaluation. There are certain things such as evaluation by your proctors, NBME, patient communication. So there are like 6 to 7 criterias, and based on that, you get a total grade. So the NBME marks of that consist only of the 30% of the total assessment.
Okay. Thank you.
Welcome.
Purva, regarding the earlier explanation, I have one more doubt. Like, is it good to first start with theory and then go to the questions, or do the question and regarding the explanation, do the theory simultaneously? What is the preferable one?
Yeah, very good question. Look, theory, I would say that don't be under the impression like, okay, I've not studied this topic, so let me first study this completely and then I'll do the questions. Don't do that. Continue with the questions, because look, when you use the Q banks, for example, you are using UWorld, let's say, don't use it as an exam resource. Use it as a study tool, like a study guide. So like, because when you read the questions, that is the time you will do an active recall, right? When you read, it's just passive reading. When you're doing the questions, you actually read the thing and you're like, okay, so even then, when you're doing the questions, try to have some sort of differentials in your mind before looking at the answers. Because many a times what happens is you go on reading the question like a story, and then you see the answers and you're like, okay, this is usually the most commonly asked thing, so I'll pick this. Or maybe you're like, okay, yeah, I think this is the answer, but then again, you will see the options and you will talk yourself out of the correct answer, and then you will choose the wrong one. If you already do UWorld, you would know what I mean. So yeah, so basically don't do that. Continue with the questions, and like as you do the questions, you will get on, like you'll keep on learning, and also focus on the questions more than you do on the answer key. Okay, because again, answer key is just, if you do, like if you are just like, okay, I just have to get done with this question, you just pick some answer and then you are like, I'll review the answer key. That is again a form of passive reading. So don't do that. If it takes time for you to get through the question, let it take time. Okay, just go to the
I
question and answer.
I've heard that UWorld and Embers are the best resources. Like most of the people use UWorld, but other than UWorld and Embers, is there any other recommendations for QBank?
For QBank, well, obviously you can do the self-assessment provided by NBME. There's also one book. Wait. There's a book also published by NBME. It has a few questions for both step 1 and step 2, which I did, and it's not much, so like you can get it done within one day. Just a second, I'll look it up. Yeah, so this is called subject examinations. You can find it on the NBME website. So you can get those done as well. They are really good for your reviewing of the basic knowledge. So I will definitely recommend that. Kaplan, I didn't feel was up to the mark, because what I felt with Kaplan was it was good for your medical school or board exams, but not that good for the USMLE, because it goes in very depth and does not give you like a broader perspective that UWorld or AMBOSS provides. So
Okay, last one question, that for pharmacology, the resource, I'm not sure what to use. There are sketchy videos, but I think it's more preferable for micro than for farm. So any suggestions for farm and as well as for physiology?
like in the sense of videos.
Yeah, videos.
Okay, well, there's BNB. You can use BNB. You can refer to osmosis. What else is for farm? Oh, you have Kaplan. Kaplan videos are good for farm as well.
Like I'm currently using RX, USMLE RX quick videos or something
Those are
like that.
good also. I have heard. I have not used them, but I have heard those are good as well.
Yeah, because it sticks to just first aid. So
Mm-hmm.
I think they are like pretty short and well explained.
Yeah, so continue with it. Look, if something is working for you, continue with it. don't be like, okay, this is working for me, but then you see someone else doing like this much big of a book and you're like, oh my God, he's doing this much, I should also do that much. Don't be like that. If what you're doing is working for you, continue with it.
And how to prepare a week prior to exam, like by this I mean how to revise the whole material in a very short duration of time.
Look, by the time you're like a week from exam, you're pretty much done with everything. You don't really need to sit and review all the systems. What I would suggest is just continue doing 50 to 80 questions per day. That's all. I won't suggest to like I won't suggest that you stress out yourself because it's just 1 week for exam and cramp up as much as you can, because by that time you should be pretty much done with all the stuff. So yeah, so just so that you keep on revising and not get out of touch with it, because what happens is even if you take like a 4 to 5 day break and then you come back to studying, first of all, it's very tiring because you are out of habit for sitting that long and thinking about it. And also, secondly, what happens is that you kind of tend to forget stuff or you get stuff mixed up. So I won't recommend like not studying for a week. I would just say that do a minimum of 50 to 80 questions and review those per day. That's it. And also, before you do the USMLE, I would just suggest to do a recap of first 8 months. Not like read the entire thing, but only what you feel is important, like stuff that you don't remember, maybe. Just that.
Thank you, really helpful.
Thank you.
One last thing. As you said that in many books and many resources, all the stuff is like in too much depth. So they are useful for university examination. I mean board examination, but not for USMLE and all that stuff. So before USMLE, we need to pass those examination first, right?
Oh.
So it's happening like this is important for now, and we ignore the other stuff and we'll do it later. So how did you manage to cover all those stuff?
Look, the thing is for board examinations, they are basically just building like the board examinations as in the school examinations, the medical school examinations. They are just building your basic foundations. So the stuff that you are tested on in the school could be in depth of a particular topic, but that may not be necessarily important for USMLE. For example, in USMLE, there are certain high yield topics, right? So it is not advisable to ignore those high yield topics and change behind the topics, like, you know, the integrity stuff that you are never tested upon, but you think, okay, I don't know this and I should know this. So like rather than focusing on that, know all the high yields, and then if you still have time, then go behind it, because it's a waste of your brain space to like remember everything, because it's a vast portion. You're not going to remember all of it, and frankly it's not necessarily that you remember all of it. As long as you have the basic foundation in your mind, you can build up on it. So for example, you don't need to remember all the formulas, right? You don't need to remember like, for example, if you know the mechanism of action of a drug, you don't need to remember its adverse effects. You don't need to remember its drug interactions, because you can, you know, make a connection readily. You don't have to memorize those stuff. As long as you know, okay, this is a mechanism of action, you're done. So like try to memorize it in a way that you make a pattern out of it. So like there's one pattern and you can apply it to multiple things, right?
Thank you.
Okay.
Hello, Purva. First of all, congratulations to you. So, I'll be starting my MD1 this February. So, what advice would you give for beginners like me?
Oh, for MD1. For MD1, I would just say I won't recommend going to UWorld or any of those resources actually, because those are all the review resources. As I just told Renuka, that for like basic sciences, you need your basic foundations. So if you have your basic foundation strong, then you will be able to build up on it. But if you start using UWorld now, which is a review source, so you're reviewing now and you will review later. So when will you study in depth, right? So this is the time that you do study in depth. So if like go through the slides, obviously. If you want, there are certain books that your professors would recommend. There's Moore's, there's Gray's Anatomy, there's Human Atlas, there's Lipton's, Colchin's. Your professors would recommend. If you're interested, you can ask them, they would recommend. And like, go through it. Go through those books. Also, again, those books are very big. So like, I won't suggest you sit and read all of those because you have to complete the entire course in 2.5 years. So just the stuff that you're confused about or that you're not very clear on, okay, I would just suggest that go to the book and look up those topics and you would be done. You can also see videos such as sketches or boards and beyond. You can do that, or RX. Those are good resources. You can see those videos, take up notes if you are into it, and yeah, I think that's how you would prepare for your board.
Yeah, thank you so much. That helped a lot. And could you tell me, so when should I actually start preparing or focusing on USMLE, like USMLE based studies?
I would say you should start in the beginning of MD4, or rather as soon as you finish your MD3, because by that time you're pretty much done with, everything. And MD4, I think, mainly only has some pharmacology and pathology, right? So yeah, so I would recommend you start after your MD3, whatever you have done, like say anatomy, you would have done anatomy, you would have done embryology, histology, you would have completed your basic principles. So I would recommend you start with that, and then simultaneously do what you're learning in MD4 in the classes. And after you complete your MD4, again, you would have like a 9 to 10 week break to prepare for your NBME, right? So yeah, give that NBME, you would get an assessment, see the areas where you lack, and then you can work yourself on that.
Okay, thank you.
Hey Purva, first of all, congratulations. Really happy for you. I would like to know what resources we should follow for biochemistry.
For biochemistry, I think for biochemistry also you have Kaplan. Besides Kaplan for biochemistry, I'm not really sure actually. There's Lippincott, that's a book. And for questions, oh yeah, there's this, hold on 1 second, I'll look it up. There's this online question series, Natasha something, just a second.
Also, I've heard about Ninja Nerd. Is it that good, or I don't know exactly about.
I haven't used it, so I wouldn't be the best person to tell you about it. Sorry.
No problem. And just now you told about the important topics for USMLE. So, how to like from where to get to know about those important high yield topics from the
Okay, so
resource.
while you're preparing for steps, or as you go about doing your Q banks, let's say you're doing UWorld, right? You would get to know the high yields by yourself, like, because I or anyone else won't have to tell you, because when you go through the questions, what you will notice is that on some particular topics you have more number of questions, and on some other particular topics you don't have that many questions, hardly 1 or 2 questions out of the entire, I think it has 4,000 questions, the entire series has 4,000 questions. So the questions that, like, maximum questions asked on the topic is an important topic, that would be the high yield topic.
Okay. And is it good to revise the material which we did, like when we were doing MD1 and MD2, all that topic, all that material, or just like Kaplan and the review books? Those are better, or the material
For your
we did?
step preparation?
Yeah.
Yeah, definitely the review books. No, because as I said, when you're studying for your boards, like your school examinations, you study in detail, right? A particular topic, for example, there's a PPT about a particular topic that goes into depth of that topic. You don't need that. because you already know that. So don't waste your time reviewing those. Just go for the review topics.
Oh, okay, I see. Thank you.
Welcome.
Hello Purva, congratulations. I just have one question. Like, should students aim for excellence, or should they stick like point to point? Like, this is relevant for me. This is going to come in USMLE. I should focus on this, and not on the entire stuff. Like, what should we prefer?
Rook, the thing is, if you focus on what's important for USMLE, does not mean that you're not aiming for excellence, because the stuff that they ask on USMLE is the stuff that you would encounter in your daily life. Like, they won't ask you about a rare disease. It's very rare occurrence, like hardly a question. For example, one question they would ask you about a very rare disease, right? Usually they would only ask you stuff that you would encounter in your day-to-day life. And I think that is more important to know rather than something that you might never see in your entire life. For example, Brugada syndrome. There's like hardly any people who have that. So I won't recommend knowing, in depth about that particular topic and not knowing anything about hypertension. Because hypertension, every other person has it. That is something you should know, right? So, and that is what you would mostly be tested on in USMLE.
Okay.
Hello, Purva. Sakshi here.
Right.
I just have a question. After MD4, we just get 2 months before NBME. So how did you prepare in that time? Like just in just 2 months for the NBME?
Okay, for the exit exam you're talking about.
Yeah, not NBME.
Look, during that time, I just went over first aid, right? And I mostly focused on pathology and pharmacology because a huge chunk of exam, I think about 50% is focused on pathology. But also, like for the steps, they have changed the pattern a bit, right? So now they're mostly focusing on the general principles. Even the pathology that they will ask is related to general principles. So that's your immunology, your microbiology, general pharm, general path, stuff like that. So know that very well, know your biochemistry very well, because everything they're asking now on even on the steps, I think even on your self-assessments, if you have done them yet, all of them, they're linking it back to the general principles.
Okay, and which subjects should we prefer more for this preparation?
Which what?
Which subjects we prefer more?
Subjects.
Yeah.
Well, again, as I said, you know how well you have prepared in what area, right? So focus on the things that you think you need to focus on. For example, let's say you're very good in path, right? So don't give a lot of time for path. Like review path. I'm not saying ignore path completely, review path, but say you're weak in farm. So dedicate more time to farm. It's again on an individual basis. I can't tell you, okay, give more time to path because path is like 50% of the exam. It is 50% of the exam, but then the other stuff comprises of the other 50%, right? You can't just solely focus on path and ignore everything else. Then you won't score. You only will score 50%. So adjust according to how you have done and according to how you think you should, distribute your time or divide your time.
Okay, got it. And there was just one more question. According to you, which question bank is the best, like the UL one or the USMLE RX one?
I haven't used RX. For me, I thought UL did, suffice. I did also use Amboss. Amboss I found pretty good as well. I used Kaplan. I did not like it that much. I did not use RX, so I can't say about that.
Kaplan for all subject or just for farm, bath, that's it?
No, I used the Kaplan Q Bank, like the entire Q Bank. I personally didn't find it helpful. You can give it a shot. Maybe if like that works for you, go ahead with it. But I personally didn't find it that helpful. I thought UWorld and Amboss were more in sync with how the step one usually presents, especially the UWorld. Amboss is, I feel, more difficult because when you do the Amboss questions, you will realize they throw 2 to 3 curveballs at you, like some distractors, and you should know what like what are those distractors, what to avoid and what to focus on to come to an answer. In UWorld, it's just one or two distractors at most. And that is the same how it is in the step one as well.
And what to use for farm, the Kaplan videos or the sketchy videos?
That's again personal preference. I would recommend that you watch, like say, one video of both, right? And whichever you think is is more comprehensive or more like that you are able to retain from more, I would suggest go with that resource.
Yeah, for me, the sketchy ones are good.
Yeah, then stick to it. Look, don't be like, okay, I'm doing sketchy, but she's doing, let's say, Kaplan. So I should also go and see Kaplan. If sketchy is working for you, stick to it. Because
Okay.
sketchy is also a good resource.
Okay. Thank you.
Okay.
Purva, one more thing.
Yeah.
Do you know, like, if there is like subject-wise distribution of marks in NBME or USMLE? Like, what
Yes.
subject we should prepare more? Like,
Yeah, it is. See, it is there in both NBME as well as USMLE. And as I said, usually if we say subject-wise, I think it's PATH is the most. I think PATH is like 48 to 52. That's why I said 50% of the entire exam comprises of PATH. But again, as I said, don't be like, okay, this is 50%, so I'll just do PATH and ignore everything else, because you will only get 50% if you do that, right? So focus on what you think you are not good at, right? For example, if you're very good at PATH, then don't spend like so much time only on PATH. Do PATH, but also do some other subjects that you think you need to work on more. I think it's usually, however, I think it's PATH, then it's physio, then it's pharmacology. Yeah, as far as I remember, those are like the 3 P's I went on.
thank you.
Anything else?
Hi, Purva. First of all, congratulations for clearing step one.
Thank you.
And you've answered pretty much all of my questions with such detailed and I think accurate explanations. Just a little question that I had. When do you think that we should buy the UWorld subscription? After MD3 or before that?
UWorld subscription, I think you should do it when you're doing your non-dedicated period, right? I think you should do it after your MD4. Maybe like when you're preparing for your NBME after MD4, you can buy your UWorld then.
Thank you.
Definitely won't recommend it buying before MD4, because you're not actually done with all the stuff that you need to learn, right? And if you start reviewing it early, the thing is you won't retain as much. And if you think, okay, I'll do a second pass of UWorld because now I have done it once and like I have completed my MD4, obviously you would have by that time. And if you think I will give a second pass, that's not as fruitful as well, because when you do a second pass, there might be some questions which you would be like, oh, I did this before and the answer for it was this. So you might not really read the question, you would just look at the answer and you'll choose the answer and you'll move along and you think you got the concept, but you really won't. Am I making sense?
Yes, thank you.
Hi, Purva. First of all, congratulations for cracking your step one. My question is there any particular book that is just dedicated to the question bank so that we can just stick to one book and solve all the questions? I'm talking just about the dedicated preparation.
For the dedicated preparation, no, I would recommend you purchase a QBank resource. If you're interested in a QBank book during to use during your non-dedicated preparation or even during your medical school, there is BRS. BRS have really good QBanks. Then you have, I think it's called something from B. Wait a second. I think it's physicians something. maybe you can Google it. But those two are really good Q banks in the book format if you want to do Q banks. But definitely won't recommend it doing in the dedicated preparation. I would say you do it in the non-dedicated preparation or even during your, medical school exams.
No, actually, there are a lot of question banks for non-dedicated preparation. Matlab, anything for while you're doing your medical school subjects like anatomy, physiology. So something so that you can test how much you've learned
Exactly.
side by side.
Yeah, for the same thing. You can use BRS for the same thing.
Okay. Thank you.
There's also, there's also online. You can check it out. It's called, wait a second. Look, whatever topic that you want to do, type it out on Google and you would get this Q bank called, I'm really not recalling the name. It starts from Q. You would get the question banks for all the topics there, right? But that's online. It's not a book resource. It's online, but it's free of cost. And they have like questions, flashcards, matchings. So you can.
Is it Quizlet?
Yes, Quizlet. Yes, that's the one. Yeah.
Thank you.
Okay.
Purva, I have one question for you. For any exam, there are some do's and don'ts. You have really explained very well about the do's, but speak specifically about don'ts. What can be avoided because students are making some mistakes, and probably that have bad impact on the time which is required for preparation. So, what exactly we should not do while preparing for this examination?
That's a very good question because it's usually the don'ts that are more important than I think the do's, because like do's everyone tells you, right? Do this, do that. So definitely one thing, as I said, don't branch out to too many resources. I did that and it is just a waste of time. Stick to the resources that you do know are good resources. For example, if you guys use first aid, if you go back on the first aid before the itinerary, there's a page called resources, 2 to 3 pages called resources, and they have graded the resources. Like the resources that you could use for step 1, they have graded it A plus A. So whatever resources are there in A plus A minus, those are the good resources. So if the resources that you're working are within those categories, go ahead, use them. They're good resources. And again, don't be like, okay, I should use all the resources in that list. Don't do that because there are a lot of resources and you don't have that much time. And also it's not needed that you use all of them because all of them again have the same content. So stick to whichever is working for you. Go ahead with that. Another thing I would say is that have self-confidence. Like don't lose your confidence when you're doing Q bank, for example, and you're getting, let's say, 2 to 3 questions wrong in succession, and you're going, oh my god, it's not a good day because I'm getting so many questions wrong. Keep calm, have faith, because once you start thinking that you're not getting it done right, that is when you kind of miss a lot of correct answers, or maybe you change your correct answers to incorrect answers. So that is actually the most important challenge that I faced when I was doing my examinations, that if you think you're not doing that well, or if you are having doubt in particular question, don't be like, okay, I'm not doing well. Keep calm and be like, okay, this is going well, it's going well. Keep telling yourself that and you will do well. Okay. So don't doubt yourself. That's one thing I would say. Because, and also if say there's a question and you're not able to pinpoint the answer, right? You eliminate the answer choices. You're down to say 2 or 3 answer choices, and you can't pick one from it, but you have a gut feeling that okay, it is this one. I would recommend you go with it, because again, leaving the question it's not recommendable, because they don't have negative marking. So even if your answer is wrong, it's better that you mark something rather than miss the question. And the thing is, what I said is that mark the question that you like, mark the answer that you feel is right, is because you have spent years in your medical school learning this stuff, and then you have spent your preparation time as well learning the same stuff. So when you have that intuition, it's based on that feeling, based on your preparation that you have done until now. Okay, so don't like doubt it, go ahead with it. If you feel this is the answer, let's say if you feel B is the answer, go ahead, mark B, move on to the next question. Also, don't spend like a lot of time just stressing on one question because you have a time limit and you can't afford to spend 5 minutes on one question and then rapidly move on to the next 5 to 6 questions. That's not wise as well. Again, as I said earlier, consistency, like keep on doing, even if you are not in the mood, even if you are very tired, let's say, do a minimum of one block per day. Let's say you don't get time to review it, that's fine, as long as you review it the next day as well. Okay, and yeah, and make sure you don't have a burnout. So that what that means is that plan for activities that you like, right? For example, if you like painting, have some time every day to paint so that you refresh yourself and don't get burned out. And yeah, what else? Also, yeah, keep realistic goals. So for example, you can't be like, okay, I'll complete UWorld in 1 month. No, because UWorld is 4,000 questions. Even if you do it every day, how many questions will you do per day? And if you're just like in a hurry to complete the resource because you want to do it, like you want to get it done quickly, you're not doing it effectively, right? Because what I think is if you do 50 questions per day, but you do them very thoroughly and very detailed, that is more fruitful than doing, let's say, 200 questions per day but like not reviewing them, just going through it. You would never know the answer, you would never know why why the answer that you picked is wrong. So yeah, won't recommend that. Yeah, I guess that's about it.
Thank you, Purva. When you were explaining all these things, one moment I thought that I should also try this exam.
No, actually, I mean, the exam is hyped to be this, like, a very difficult exam, one of the most difficult exams, it's said. But I think it is, like, personally, I feel it is also because, this is one of the most important exams to kickstart your career in this medicine field. But if you're, if you are like religious about doing it ritually, as I said, like if you're ritually about it, like doing 50 questions, for example, per day, or doing 2 blocks per day, it's not that difficult.
Purva, one more question. Exactly tell us what kind of pattern is this new, because new pattern, I have seen so many videos, but I'm not getting the clarity about the pattern. What exactly it is now?
Okay, so the question patterns is more or less the same. The question patterns have not changed, but what has changed is the distribution in which they would ask. For example, they are going to focus more on the communication questions, which is how the patient, or how the physician basically communicates with the patient. So you would have more ethics question in that sense. Also, you would have more general principle questions. So like in a research laboratory, they would give you, for example, an experiment, and then that experiment would be linked back to your biochemistry or your laboratory techniques. So that's why I said that now, like these days, they're focusing more on the general principles. So as long as you have a good hold over it, you can relate it to any system or any tissue or any disease as such. And as I said, it's better to keep a pattern, organize a pattern. For example, if you say low blood volume, so in low blood volume, if you think, okay, if a person has low blood volume, you have to know that their heart rate is going to increase, that cardiac output is going to decrease, that SVC is going to decrease. These are like basic things, right? So now you have created a pattern. So if you get any question and you have the person has a low blood volume, for example, if the person has internal bleeding, or if the person has like motor vehicle accident or gunshot wound or a stab wound, or if the if there's DIC or postpartum hemorrhage, Sheehan syndrome, basically any scenario in which you recognize that okay, there's loss of blood, and this is low blood state, right, low volume state, you can directly apply the principles. Like as I said, in all of those scenarios, heart rate would increase. In all of those scenarios, cardiac output would decrease. So you don't need to, let's say, you don't need to memorize it or each and everything. You can just apply it to all of those.
Please unmute yourself. There is some disturbance. Purva, please go ahead.
Yeah, so I think that's what they are changing in terms of pattern. And obviously now it's pass and fail, so you don't have to worry about how many marks you are getting as long as you pass. So when you do your self-assessments or NBME, just make sure that you have enough of a margin so that you know for sure that okay, yeah, I'm going to pass. Like obviously the marks are not a consideration anymore, but as long as you do your like self-assessment and NBME, let's say well above a margin of like a decent margin, let's say, you can be sure that okay, I'm going to pass my steps. That's just you help with your self-confidence, basically, nothing else, and to reduce your anxiety post-examination. Also, I would recommend not to study at all, actually, if possible, before the day before the exam, also before you go to the exam. So I would recommend like relax completely the day before, watch your favorite movie or do whatever you like, whatever activity that you like, relax, have a nice 8 to 9 hours sleep, and then go to the exam refreshed. If you want to do something, just go over the formulations, go over biostats, but like don't do more than a couple of hours of study. That's what I would recommend. Because like you have done it till that period of time, you're not going to cramp up more in 24 hours than you have in so many years. So hope that answers the questions.
Thank you. Thank you.
Okay.
Yes, anybody is having any question? Anybody want to ask anything? Any doubt? Okay. Okay, I hope the question answer section is done. And I think, yes, Purva answered all the questions. If there is anything, you can be touched with Purva, even though she is going to fly on 27th of this month, January. So be in touch. She will be on WhatsApp or so many media, like social medias are there. If there is any doubt, you can ask her. There are so many people, like say so many students, those crack USMLE step 1, step 2, step 3. And we arrange a session maybe twice or thrice in a year, every year, so that you can get a chance to speak with the students and just to clear your doubts or get more clear picture about your examination, about the studies, about the curriculum. So with the permission of all of you, I think we have done, and I'm going to end this session. Thank you very much.